Well, good afternoon, everyone, and thank you for joining us for one of the COVID-19 briefings on behalf of the City of Richmond. Today, we have now passed 4 weeks since our state of emergency order, local declaration of state of emergency. It's been 4 weeks. In that 4-week time now, we have 163 confirmed cases and, unfortunately, 7 deaths. I'd like to take a quick moment of silence for those who have perished over the last 4 weeks because of COVID-19, and those right now having our thoughts and prayers with the families who are dealing with the crisis. Thank you. The last couple of weeks, working alongside Dr. Avula with the Health District, we've talked about how we can dig a little bit deeper into the data and see, just speak to the identities behind those who have been confirmed and those who have perished because of COVID-19. And Dr. Avula will go a little bit more into this, but looking at the racial data currently that we have, 62% of those who have been confirmed cases of COVID-19 are African American, and 24% being white. That follows a trend that we've seen across the country in terms of this having a disparate impact on communities that are black and brown. And obviously, sometimes this puts a spotlight on some of the divides that we've talked about in the healthcare world, in terms of, and also in poverty, the financial crisis from a decade ago. It hits communities that are black and brown the toughest, the hardest. And we're seeing that play out, unfortunately, through this pandemic as well. And so let this be a reminder that although we have a higher rate of individuals who are black and brown who have confirmed cases, that just because you're black and brown doesn't mean you're going to get COVID-19. Now, what we have to understand, if you do contract and you're black and brown and you have underlying medical conditions, it could lead to your death. And that's why we have to take this threat seriously. We all do. This disease knows no boundaries, knows no race, gender, creed, nothing of the sort. And we all have to take it seriously. Every single community. Now, Dr. Avula is going to talk a little bit about where we are in the process in terms of our mitigation of the spread. And I would say here in Richmond, we are doing a good job. But I believe we can do even better in preventing the spread of this virus throughout our community. As I stated last week, we are on the front end of this roller coaster ride. We haven't gone down, we have not reached the apex, and we haven't gone down the hill yet. That means that we have to be even more vigilant to ensure that we protect our families throughout this. We all have to act as if everyone around us has the virus. That's our greatest weapon right now, is thinking everyone has the virus, and the best weapon is to stay home, if you can, to stay home. We also know that the virus has also had an impact financially on our people, but also there's an economic impact as well. Yesterday, this administration presented to the City Council some proposed amendments to our FY 2021 budget. And we were able to state that there will be a $38.5 million hole in terms of our projections. And we've made some tough decisions, but I think they're responsible decisions in reducing our budget at roughly 5%. The city's shortfall will also have a shortfall for FY 2020 as well. We had projections that showing that we would have a surplus coming out of FY 2020, and now that will be a surplus there as well. So we are, in response to these impacts, we will obviously be seeing no pay increases for employees. We're cutting more than $9 million in personnel funding. We're going to level fund what we believe are our priorities, whether it's public education. They'll get a little more from this. affordable housing, the eviction diversion program. Those priorities will remain the same in our FY 2021 budget. We also know that this budget aligns with our priorities in supporting our schools and our children and public education, also fixing roads and sidewalks and making the city a more equitable and safe place to raise their families. Ladies and gentlemen, this is indeed a tough time. We have not seen anything like this. There is no playbook for this. And in these tough times, it calls for some tough decisions to be made. And this administration is willing to make those decisions. But we still have to rally around a set of values. And those for us is in equity and in inclusion, but also in fiscal responsibility as well. This is a tough time, but what I know about this city, what I understand about this city and its residents, that we are going to get through this. This is a dark time right now, but there will be a light at the end of the tunnel. And I also want to caution, particularly there's leaders out there who are already starting to speak prematurely about opening society again. We have to remain cautious about that because we don't know, we haven't had an enormous amount of testing where we know whether or not who has it and who doesn't have it. And so with that, we have to remain cautious about what the future may look like. A reopening will not mean back to full-on scale before the middle of March. And I know the governor will be commenting more about this as well, but what I hear out of the federal government talking about things are going to be back to normal in May, that's a farce. That's a farce. That is not going to be the case. And this administration will not mislead the people of this city to thinking that things will get back to normal in May. We can't foresee what will happen next. Remember what Dr. Fauci and others have said, epidemiologists, that the virus will dictate the timeline. And the people of this city will play a role in that as well. If we adhere to the guidelines set by the CDC, by the health department, we were able to weather this storm and shorten the period of this new normal. This is a temporary state. But let's not believe that the future is right around the corner. We have to do everything we can today, right now. And that means staying at home, if you can. Continue to social distance. Staying 6 feet away from people. Washing your hands, and if you can, please get a mask. These are all things that we can do in our own power. Our personal responsibility in this time of crisis. I'm going to have Dr. Avula come up and talk a little bit about, give some health-related updates about what's going on in the district. And also, we'll have Superintendent Jason Kamras come and talk about Richmond Public Schools. So, Dr. Avula.
Thank you, Mayor Stoney, and good afternoon, everyone. Since we were all last together, we talked about the need to have some more granular data, particularly as it relates to race. As you heard the mayor announce, we've been able to do that for both our cases and the folks who have lost their lives here in the city. And so our team will continue to do some more nuanced analysis of that. So for example, we've got 62% of our positive cases are African American, 24% white, a small percentage that are Hispanic or multiracial, and then about 10% that are still unknown, either because we haven't been able to get in touch with those patients or they just weren't documented. So the team will continue to work on that. But as we look at that distribution, we need to think about what's also the age distribution in our city. Our overall census numbers show about a 48% incidence of African Americans, and then the 46%, I think, of whites in the city. So we'll do some more nuanced analyses of race and as much demographic data as we can. Again, recognize that things like socioeconomic status are not typically collected in a medical record. Usually when we do that kind of analysis, we use proxies. So for example, if you are covered by Medicaid or you are uninsured, we're able to do some analysis like that. So I'll be in touch over the next few days about what our team is able to generate. We have also recognized the inequity in access to testing. And so for weeks, this was the reality for everybody, that there just was not much testing capacity throughout the entire Commonwealth. This has improved week in, week out. We've seen more and more providers and urgent care centers in particular. And I would still say there's a preponderance of folks who get tested are actually individuals who get hospitalized, but over the last 2 weeks, that has started to shift, where urgent care centers are becoming one of the greatest sources of testing, in addition to long-term care facilities where a lot of testing is currently occurring. So what the state has been able to do in their conversations with both VCU and the University of Virginia, because those hospitals currently are not quite using all of the testing capacity that they currently have, they've been very willing to say, let's deploy this however we can need. And so we're really looking at those two populations, residents of long-term care facilities, and then and underinsured people of color throughout our community. And so as early as next week, Monday, we're looking to deploy testing teams, through our resource centers, through other, low-income neighborhoods that are not necessarily public housing, and then we're currently recruiting medical teams that we will fit test to make sure that they can wear appropriate PPE, and then we'll train to do the nasopharyngeal swabs. And so if any of you are interested in that, please get in touch with the Medical Reserve Corps at your health department. That link can be found on all of the health department websites. But we really could use any healthcare personnel who can get trained quickly to be part of those testing teams. Our goal is to be able to do one testing event a day in underserved communities across the region, and to test somewhere between 100 and 150 residents. In addition to that, we, with the help of our partners, with the Community Foundation and others, are amassing cloth masks and hand sanitizer as well, and so those will be part of the distribution plan. So in addition to testing to identify where the disease is, we'll also be offering those preventive measures. As the mayor has said, the guidance around what we should all be doing to prevent this doesn't change. It's still stay at home, maintain that 6-foot distance, wash your hands, wear a mask if you have to go out. But what we also know is that, when somebody is identified with this disease in your office or at a nursing home or in your neighborhood, you begin to take it more seriously and adhere even more rigidly to those guidelines. And so our hope is, by providing more testing in communities where we have many uninsured residents, not only are we addressing the inequitable access to testing, but we're doing case finding in neighborhoods where residents may respond differently and may hold even more tightly to those stay at home and physical distancing guidelines. I will pause there.
Now we'll have Mr. Kamras with Richmond Public Schools.
Thank you, Mayor. First, let me just say thank you so much to the City of Richmond for all the support that the city has provided, that the mayor has provided, and certainly to Dr. Avula as well, who has been available 24/7 to provide guidance and support. We are incredibly grateful to you both. Just a few updates. First on food, second on academics, and third on technology. So on food, we now have 55 locations across the city where we are distributing food. On average, we are distributing about 13,000 meals a day. That's Monday through Friday. And we are working with our Office of Engagement to personally reach out to any family that has experienced housing insecurity over the past year, to make sure that they are getting food along with other supplies as necessary. Our food distribution will continue throughout the closure, and again, Monday through Friday at 55 locations. You can find that information at our website, rvaschools.net. Second, on academics, last week we launched RPS at Home, which is our online learning system for the time that we are closed. It is a set of pre-packaged lessons that leverage our teachers who have recorded videos and provided instruction for every grade and every subject. Again, that is all available on our website. All you have to do is you go to the website, find the grade for your child, click on today's date, and you have a set of lessons, English, math, science, history, for the day, and then you can do that tomorrow and so on for the entire duration of the closure. We have extra supports for students with IEPs and students who are English learners. We also have on-demand tutoring help, so you can find all of that on our website, again at rvaschools.net. Third piece, technology. We know that many of our students do not have computers at home or do not have internet access. We have put out a survey to identify anyone who needs a computer or internet access. Thus far, we have had over 12,000 students sign up. We have begun our laptop distribution starting today. Seniors received laptops, those who needed them, so they can complete any requirements that they need for graduation. And then on Friday, next Monday, and next Wednesday, we will distribute computers to the rest of our high school students who have signed up. Then we'll do middle school and then elementary school until every student has a laptop and internet access if they need it. Last, let me just say, anyone who wants to volunteer with food distribution, with computer distribution, we have a link on our website where you can sign up. Again, rvaschools.net. If you'd like to donate to help RPS, that is welcome as well. And you can do that at the RPS Education Foundation website, which is rpseducationfoundation.org. And finally, let me just say to all of our students, if you're watching or if your families are watching, though our buildings are closed, our hearts remain open, and we are here to support you in any way we possibly can. We love you very, very much, and we will be here for you throughout the pandemic. Thank you.
Okay, guys, we have time for a few questions for either the mayor, Dr. Avula, or Superintendent Kamras.
And real quick, Jim, I would be remiss if I didn't first thank Mr. Kamras and also Dr. Avula for their hard work, and also to a number of the essential city personnel who are still showing up to work each and every day throughout this crisis and this pandemic, and also a number of other workers out there who are still operating and keeping the city going, those in grocery stores, bus drivers, our healthcare workers. These are the true heroes in a time, and also the media as well. You all are essential to society continuing throughout this difficult moment, and I want to say thank you, thank you, thank you. So with that.
Can you talk about the plan as far as testing next week in low-income communities? Where exactly is that going to, you can tell us the neighborhoods, and if there's any that are outside the city in Rango?
I'll let Dr. Avula kind of crystallize that for us.
So the most likely places right now, just because we already have relationships and infrastructure, are the 8 resource centers in the city and a few neighborhoods in Henrico County. We're still working out all of the details about which site on which day, but those resource centers are in the large RHA communities, the 6 large RHA communities in Southwood and in Broad Rock, is where our 8 resource centers exist. And then we also have connections and on-the-ground presence in a few neighborhoods in Henrico as well. St. Luke, Henrico Arms, and then we'll also look at demand and opportunities in London Town and Nottingham Green, Hope Village, a few others. One of the things that we've got to plan between now and next week is, what are the logistics? We've done drive-through clinics, and so have a system set for those. Obviously, to try to target a different demographic who may not have as ready access to transportation, these will be walk-in clinics, and so we've got to work out just the throughput and the flow and what's the staffing model that's needed for those. And then in addition to those communities, it's really focused on our continued focus on long-term care facilities.
Jake?
Will those, when they come in and do the walk-in clinic, will we only people that are showing symptoms, will it be people that are asymptomatic, who will be able to get a test in this scenario?
Yeah, primarily we're gonna continue to screen for symptomatic individuals. Obviously, we have seen from the beginning of this pandemic that asymptomatic spread is a big part. What we're seeing in congregate care facilities is that asymptomatic spread is a even more significant part of transmission than we realized. But again, because we don't have unlimited testing capacity, we'd really like to focus on symptomatic individuals or individuals who have come into contact with confirmed cases.
Dr. Avula or Mayor Stoney, can you talk a little about the preparation for the convention center and the VCU honors forum for patients, where that stands?
I'm not as familiar with where VCU's overflow planning is. The alternate care facility, the ACF, that the state is planning at the convention center, there's a call this afternoon to kind of determine how hard are we pressing on the gas pedal with this. Planning has been active over the last week and a half. All three health systems have contributed in terms of the specific model of operations, how much staff it would need, how many beds, those kinds of details. As the projections kind of continually have changed, and we've seen multiple states, Washington State, New York, Louisiana, that are all now on the back end of their curve, it has raised questions, understandably, of whether this overflow capacity is even going to be needed. So we don't know that answer now, and we're very much still, as the mayor suggested, we're still very much on the front end of this curve. So depending on how quickly that rise continues and what the hospitals are seeing, that'll help us know whether the ACF really needs to be mobilized or not. Right now, capacity looks really good in the health systems throughout the state. We're only at about 25% of ventilators across the state of Virginia that are currently in use, and there are about 6,000 vacant hospital beds throughout the Commonwealth, and our local partners are reporting similar numbers.
Henry?
Question on long-term care facilities. I know it's Richmond-centric, but Canterbury, kind of general update, how that's going, but also long-term care facilities in the city of Richmond, too. Are you guys watching those right now?
Yeah, absolutely. So we are actively engaged in 15 long-term care facilities that have confirmed cases between Richmond and Henrico. And the situation continues to be challenging, right? I mean, I think we've clearly learned a lot from Canterbury Rehab, who was on the front end of this pandemic here in Central Virginia. And we've been able, and they've been incredibly helpful in providing information and guidance to the medical directors of other facilities. But the fact remains that this is a disease that spreads at high rates in an elderly, vulnerable population before you even know you have symptoms. And so we do have multiple facilities that have 5, 10, or greater cases, and so that is actually where a lot of our staff time and energy is going right now, and working alongside those facilities, trying to continue to help instill infection control practices, because remember, nursing homes have not had to do this degree of infection prevention ever, really. This disease has presented a very new scenario for so many of these facilities. So very much at the top of our concern, I mentioned earlier with this additional testing capacity at VCU and UVA, that much of that will be focused on supporting the testing needs. Right now, through the state resources, we're able to test anybody who is symptomatic involved in a cluster. Now with this additional support from VCU, we can start testing asymptomatic residents of long-term care facilities.
Jake, this is for Superintendent Kamras. I know you mentioned 12,000 people required about getting computers and access to internet. What kind of challenges are you guys facing linking up with these families and then distributing that kind of hardware to them?
Well, we have established distribution means. Basically, we're using our school sites. We have windows of time when students come based on the first initial of their last name. And we have outfitted our staff with all the necessary protective equipment, enforcing social distancing rules and all that sort of thing. I think the biggest challenge right now is getting all of the computers configured for home use, and the partner that we work with to do all that is obviously stretched very thin at this time given the demand, and so they're working as fast as they possibly can, and as soon as the computers are ready, we're getting them out to kids.
Henry?
Just had a budget question for you, Mayor. Henrico also announced today it has to dig itself out of a hole. Richmond, I'm assuming
Well, for us, it goes back to those priorities for us, right? And, public education remains a priority to us. And, once we get through this, we are going to still have to make sure we have an educated populace, so that's going to remain a priority. Housing remains a priority, the eviction diversion program. We have to essentially go back to what our priorities are, but also reduce, we had some major plans in this upcoming fiscal year, some major plans in investing in public education, and investing in road infrastructure, things of that nature. But just like every family and businesses throughout the city and throughout this region, we've had to curtail our plans, right? And adapt to this new normal. And does it hurt? Yes. Are these tough decisions? Yes. But they're necessary. They're necessary. And obviously the localities in the region are going to all take, similar to and sometimes different approaches to this, but we're just simply going to have to cut back. And it is going to hurt temporarily, but I have no doubt in my mind that we will get back to the strength, the level of strength that we were at prior to the pandemic. It will take some time, though, to think that we are just going to just flip the switch and things will get back to the way they were prior to March 14th. If I told you that, I would be telling you a lie. I would be telling you a lie. So we got some quarters to come. We're going to be looking at this on a quarterly basis. You're going to see some fluctuations. You're going to see some changes because of the way the economy may respond to this. But we already know that, tourism is taking a hit, whether it's hospitality or those who were dining in restaurants, things of that nature. All of these sources are going to take a hit. And it's the responsibility of the city to do its part and have more realistic projections for the upcoming future. And it will be tough.
Dr. Avula, two different models, UVA and University of Washington models, are showing that Virginia will be over the hump of this at very different times. When do you suspect that we'll get over the hump?
Can we split the difference? The IHME model is reporting as of this morning, April 27th. The UVA model the governor announced yesterday is looking at mid-August at some point. I have not delved into the UVA model enough to understand, is that mostly because of hospital data and the trajectory of hospital bed utilization? I suspect that's part of why they're expecting a later peak, but I don't know enough at this point. I think some of the earlier projections around middle of May for a peak, it's probably somewhere in between there. But the important reminder is that there's still a back end of this curve, right? And so if it takes us 2+ months to get to that peak, it's going to take us just as longer to get to the other side. And again, as the mayor said, this is not a time for us to be thinking about lifting restrictions. Like, if that peak is actually going to stay the peak, we've got to remain as committed to staying at home and physical distancing as ever.
First, I want Dr. Avula, but I do have a question for you as well, Mayor. Actually, I'll start with you. As things start to amp up in terms of number of cases here in Richmond, are there any further precautions that can be taken, such as a curfew, anything like that? Is that on the table if need be?
As I stated just recently, this is a fluid situation, and the city will adapt to that situation if necessary. And if our partners at the state level, with the Department of Health and the governor, say that there are further measures that we need to take to mitigate the spread of the virus, then we would obviously be willing to take those measures. But I think the key point of all this is this has been a partnership. We've worked together openly for the last 4 weeks. And if Dr. Avula or the governor were to call me and say, Mr. Mayor, I think we're going to need to take some more steps, curfews, things of that nature, obviously I would sit down with the experts, the folks who understand what they're doing, the epidemiologists, things of that nature, and say, we have, listen to the facts and then take the necessary precautions in order to protect the lives of Richmonders. And so moving forward, if we do see a surge or do see a spike, everything has to be on the table. We're talking about people's lives here. right? And I wanted to say to everyone once again, we have to act as if not just putting our own selves in danger, right? You could put someone else in danger as well by not adhering to these guidelines. So for all the individuals out there who believe that they're Superman and they're immune to this, that's false. That's false. And it is irresponsible. If you can stay home, you need to stay home. If I could go door to door and make sure everybody's indoors, I would do that. That'd be a lot of doors to knock. Not going to be able to happen. And so it takes the personal responsibility of each and every resident to say, you know what? I could potentially put my grandparents at danger or somebody else's grandparents in danger. I would not want that on my psyche. So take the necessary measures, adhere to the guidelines, and stay at home. Dr. Avula.
One for Dr. Avula.
Yeah, Dr.
And then we go Chris, and then I think we're good at guys.
Dr. Bull, you spoke a little bit about how Virginia testing had been a little bit behind. I was actually looking at some of that data this morning. So per capita population-wise, Virginia is third to last among states in the country behind Kansas and Texas. Is that alarming? And can we, I know you mentioned a little bit about what we can do to help that. And do you think that it is more geared towards the north, Nova, or is it Chickahominy Health District as well?
Sorry, repeat the last part of that question. Is the testing happening more up in Northern Virginia, or?
The data that puts us behind, I should say.
I got you. I have not looked at the state comparison data, and so hearing you say that is surprising. I mean, some of that is that Virginia is on the later end of the outbreak across the country, but some of that is that we've had real challenges in getting access to testing, and so I hope that we, with the help of our partners like UVA and VCU, will be able to rectify that. Even now, we're while there is lab capacity, right? We have these big academic centers who've got lab capacity. We have a number of commercial labs that have popped up. There are still limitations in the things along the chain, right? So the test kits, the actual swabs and the viral media that are required, those still need to be identified, and we're working on ways to kind of construct those right now so that we can use this excess lab capacity currently. So I feel like, at least in my lens locally, we're doing everything we can to take advantage of the commercial labs that have popped up in our region, and then the state and state partner lab capacity that exists.
And then also, in terms of the number of people tested and relative to the number of confirmed cases, we're at 14.4% of the positive confirmation. Dr. Birx at the national level has said that, like, when you get to like 15%, you're actually, on the verge of becoming a hot spot. And I think, could that also be more relative to Nova, or are we in that type of concern?
Yeah, it depends. Because we have not had widespread testing available, a lot of our testing has been focused in congregate care centers. Again, through the local lens, I'm most familiar with our data here in Richmond and Henrico. So, we may be running a little bit higher because we've been doing so much focused testing on hospitalized patients and long-term care facilities where we're seeing more outbreaks. I think once we have widespread testing capabilities, we'll have a much better sense of just how much disease is across the region and across the state. We tried to do a little bit of that early on when we initially had the promise of testing kits that would come from the federal government. We moved to do community-based testing sites. We did one out at Dorey Park and one down at Chesterfield Fairgrounds. And in that, we just tried to get a sense of the folks who have symptoms in our community, how many of them are actually positive for COVID-19. And that number was about 10 or 11%. And so I think that it would be interesting once we get wider test capacity to repeat that now, to see in a month's time how much has changed in terms of the incidence of COVID-19, and then we'll have better information to be able to answer the question.
All right, Chris, last question.
So there's kind of two questions here. The statistics that you mentioned, the demographic data early, I'm assuming that that's only for Richmond and Henrico, right?
That is specifically for the Richmond case count, that 163 or so here in the city. We have about 440 cases in Henrico, and so the team should have that by the end of the day tomorrow.
And then a question for either the mayor or Kamras. The city's already said that they're cutting pay for employees. What about teachers and RPS staff? I spoke with administration officials yesterday, and they're saying, well, it's the school board's got to decide, but what are you recommending? What do you see is going to happen there for the school budget?
Well, look, we just are reviewing the numbers now, both from the city and from the state. Hopefully within the next couple of weeks, we'll have a sense of what we will be receiving from the federal stimulus package. Fortunately, the education piece of that is largely driven by the poverty rate of the school division, which means places like Richmond should get a larger share of the stimulus. So we'll see all of those different numbers and then begin discussions at the school board on Monday. And that process will probably take several meetings to come up with a final budget for next year.
Well, I want to thank everybody for coming out. Before we exit, I want to remind folks, if they're seeking help or want to find ways to help our community, please use the website rvastrong.org, a great community resource hub. And for regular updates on what the city is doing in response to the COVID-19 pandemic, richmondgov.com/COVID-19. All right?
Thank you very much.
Thank you, everyone.